Namaskar. Welcome to DFCA TV. DFCA TV is a collaborative learning platform amongst the doctors, all other members of medical fraternity, and the public. We share knowledge and skills for a healthy world. DFCA, that is Doctors for Clean Air and Climate Action, is an India-wide movement for doctors to look after the multiple dimensions of contemporary and futuristic challenges and meet them with better, cleaner air and positive climate action. Today, we are very privileged to have Dr. Salil Bhargav with us. Dr. Bhargav is a professor of respiratory medicine at MGM Medical College in Indore. He is on the editorial board of Lung India and Indian Journal of Tuberculosis. He is the co-chair of Collaboration to Eliminate Tuberculosis Amongst Indians, CETI, which is working on TB-free India. He is also the Clean Air Champion of Madhya Pradesh as part of Doctors for Clean Air and Climate Action. Thank you so much, Dr. Bhargav, for joining us today. Air pollution has been on the rise, though these days COVID is more in the news. But in your own clinical experience, how would you explain the health impact of chronic exposure to air pollution on the public health?
Rajiv, that's a very, very relevant question looking to the today's health scenario. What is happening? Purity is required at every place. And we are using air, water, and food every day, moment to moment. And out of these, air is the most important thing which we have been using. We are inhaling it in and exhaling it out, fine. So whatever we inhale, it goes inside our body and has direct impact on our lungs as well as on our whole body. So what is happening if the air which we are inhaling is not pure? Pure means it might have mixed with dust particles, it might have mixed with some gases or some other particles. Then it is certainly harming to our airways and lungs, which are going to be working as a very important part of our body mechanics. So if the air which we are inhaling is not pure, you can understand, anybody can understand what impact it is going to have on our body.
That's a very brief, precise answer and gives an overview to the people.
Yeah.
But Dr. Bhargav, we always say the air pollution season or the festival of air pollution is about to begin. Why do we call it as a festival is because we only talk about it and we hardly do anything about it. And that festival is about to begin by the end of September, maybe beginning of October. But at this time, there is also a major danger of the third wave of COVID. And this concoction, people fear, could be very dangerous this time. What are your comments on this?
Rajiv, we are talking on a very right time. In fact, what happens when the air which we are inhaling is polluted, this pollution level increases after September, as you rightly said. Particularly in those areas where there is more smoke or if there are some conditions which is leading to this. So if because of any reason this air pollution level increases, then it is going to damage gradually to our airways and lungs, that is our respiratory system. The COVID also goes inside our body through nose and it enters into our airways, and 80% of the population is because of COVID-induced infections, that is lung pathologies. You can say the pneumonias, viral pneumonias, and ARDS. So when two mixes, 1 + 1 happens. So whatever COVID damages alone will be doubled if it is mixed with a bad air pollution. So in this season, if the COVID third wave is there, then we have to be little alert. The air pollution levels should be under control. And if it is not under control, then we can understand. It's a simple logic. There is nothing into it. Simple mathematics. I said 1 plus 1. Yes, certainly 1 plus 1, not 2, 1 plus 1, 11. I don't know what it can be happening, but it can be there. So we have to be little alert while this COVID season goes up, and COVID is also there.
Let's stay on this question itself and let's take a reality bite. You have been a forefront and championing the cause vis-a-vis air pollution, tuberculosis, and you have also been working in the arena of COVID. How ready people are in terms of facing these challenges, especially from the governance part and also the public at large?
Rajiv, you must have noticed that when you breathe in and out, you have been doing it 1,000 times a day. How many times do you remember what you are inhaling and what you are exhaling? So what happens? But when you eat food, then you taste it. But when you inhale, until unless there is a bad odor, you don't understand what you are inhaling. So when air pollution is there, until unless there is a bad odor, you will not able to recognize it, because the dust particles, the other gases do not make much impact on the air's status. So we don't understand what is happening, and that's why we are not understanding what health hazard we are facing by bad air pollution. So people are slightly less aware of what they are facing. There are people who are now understanding by the help of the meters which are being put at multiple places in our cities, but still they are not looking at it. They feel that there's some numbers are coming and going away from there, so they don't understand it. So still people are not aware of air pollution hazards and the problems which are being arise, which are coming up in the market or in the body because of air pollution.
There's an old saying, ignorance is no excuse, but then people also say ignorance is a bliss. So when we are talking in terms of enhancing the level of awareness amongst the people, especially the medical fraternity, the doctors, etc., what do you think should be the responsibility of the doctors to actually look at it in a more proactive manner?
Right. What happens? There are three groups we can say. One is a general public. One is at the end, our politicians and our leaders. And in between them is the technocrats, that is the doctors, who understand both the ends. Apart from that, the people and the politicians may not understand the health measures, exactly what is happening because of air pollution. But doctors understand both the levels. They understand the quality of air and they understand the damage which is being done to the lungs. So if the doctors get involved into this mission, then it is going to be stronger, because they can convince the politicians, they can convince the public. You know, when I talk to our politicians that COPD is one of the major killers, good number of media person and politicians ask me, what is this COPD? They don't know, which is the fourth major killer, in fact, third major killer you can say in the world. So the doctors are the persons who can tell them in simpler words, simple language. It is not asthma, it is COPD, which is caused by air pollution.
In fact, you made a very important point that beyond writing the scripts, it is important for the doctors to act in a very proactive manner in the social arena and educate people in language which is very simple, easy to understand, digest in the mind so that people can turn that into action. Very well said, sir. You have been also at the forefront of managing tuberculosis and COVID for quite some time, and both are airborne diseases. Is there any empirical evidence to support the argument that air pollution has a major impact on tuberculosis?
Rajiv, we don't have any statistics or we don't have any measures to prove it at present. But what happens? Air pollution, it hurts, as I told, airways, lungs, the lung parenchyma overall. So if basically the respiratory system, which is the first attack point for tuberculosis and COVID and other viral and bacterial infections, is damaged, then anybody can understand that it is going to hit more harder than a normal healthier lung in a well ventilated atmosphere. It's very simple and very logical. So you don't need to put multiple datas or something like that, but I can show you by simply saying or simply coming to the areas where the lung pollution, where the air pollution is bad, you will see the number of COVID cases, mortality will be slightly higher, the morbidity will be slightly higher, the number of TB patients may gradually increase if the air pollution is bad.
In fact, a lot of people who suffer from TB are also scared about it because of the social stigma. And most of the time, there is a delayed diagnosis that the person is suffering from tuberculosis. Now, especially in COVID time and areas where the air pollution is going to be very, very high, what do you think should be the role of individuals and their families vis-a-vis the challenge of TB and COVID?
What has happened, you have rightly taken up this point, in last second wave and the first wave, because of lockdowns, those patients who were coughing, they were afraid that it might not be COVID. So although they were going to the doctors, but they were not reporting it. And in say around 10 to 20% of these patients, they were having TB, and which went into a bad shape. In fact, it developed into a severe form of pulmonary tuberculosis. And once the waves were over, then they reported to their nearby health centers. And then we found that they were having those symptoms. They said, yes, we were having these symptoms for last 15 days or a month or 2 months. But because of lockdown, because we were afraid that it might not turn out COVID, they didn't report it. So the condition of these patients having TB was slightly bad as compared to our normal scenario, where they can report immediately if they have got a cough of 2 weeks. They reported early. So good number of patients who were having TB, they turn out into a bad or severe type of TB.
Thank you so much, Dr. Bhargav, for giving us all these inputs. In fact, you have been spearheading the fight for DFCA also in Madhya Pradesh, and your voice is being heard nationally. I'm sure the viewers would love to know in terms of what motivated you to join DFCA, Doctors for Clean Air and Climate Action.
I always say that doctors are a very important part of society. And if you don't speak, it means you are inactive. So we should all participate, particularly those who are I call doctors as intellectual people, because they are part of it. They understand both the ends, as I told you in the beginning. The part which the society must know, and the science part they also know. So if the doctors do not participate actively, in fact, what society is constituted? Society is constituted by your own family members, your own friends, your patients. So now it is my responsibility. It is the doctors who are in this field or in other fields also. It's not necessarily that the chest physicians or the general medicine people should participate in such type of activities. In fact, all doctors, because they have got a basic training, MBBS training. So even if a surgeon is there, or if a gynecologist or a ENT person, should participate, should give some time. I don't say that you should spend a lot of time over there, but if they can spend some time on public promotion, public awareness activity, it is going to help their family, it is going to help their society, and it is going to help their nation. So one
That's
should.
very well said. That's very well said. In fact, the doctors who would be watching you would also be feeling very inspired by your zeal. So what kind of action steps would you like to recommend in their day-to-day life, which they can start working on, and thereby they can be a contributory person from Doctors for Clean Air and Climate Action, work in the areas of air pollution, and of course, enhance the knowledge of people around. So what could be those smaller 2, 3 action points you would recommend to them?
The simpler thing, that doctors are being heard by everybody, honestly, I'm telling you.
Absolutely.
Particularly if they are talking about the health part. So they should, whenever on any platform they are sitting, it may be a COVID platform, it may be a family planning, it may be a TV program, just talk about air pollution for a few minutes and connect it to that problem. One thing. Then they can write some articles in the newspapers, on channels, and in WhatsApp is a very strong media for us. So whatever system or whatever things they are doing, if they are connected to some NGO, spend some time on about air pollution, because this is high time we should work on it. We have already seen in the last second wave what has happened to the oxygen. So if we are going to cut the trees, we are not supporting air pollution controlling measures, then all of us are going to face, and our next generation will not forgive us. So we should spend some time on such type of activities. And the third thing is, if they can write some scientific articles, they can do some researches. It will give much strength to this mission.
I think you've said it so very well that in case doctors have to create a meaningful impact on the society, only three things are vital: communicate, communicate, communicate. And that too in a language which people understand, a simpler language so that people can correlate with and thereby take up some actions for their own health. And this is where doctors can act exceedingly proactively. Thank you so much, Dr. Bhargav, for joining us. This has been a wonderful brief session with us, and I'm sure people around India and overseas will definitely find it useful with the kind of inputs that you have given. And my dear friends, do write to us in terms of areas which you would like us to invite more experts. And in case you are an expert and you wish to be invited, do write to us at info@lcf.org.in, and we'll be delighted to have you as our guest. Thank you very much. We are signing off here. Namaste.
Thank you, Raj.